In today's video, I will be discussing with you the importance of athletic performance and heart health as it relates to bioidentical hormone therapy. To put this into a little bit of context, it's important to understand that there are 300,000 deaths in women each year due to heart attacks, compared to 40,000 women that die each year of breast cancer. Either way, I know those are huge numbers, but I want to take time today to understand that bioidentical hormone therapy for women, for postmenopausal women especially, can be very important in their health. After today's video, I would like for you to do two things. One, talk to your doctor about bioidentical hormone therapy, and maybe even more importantly, is get your hormone levels tested. We need to find out what your hormone levels are first to see if you're at risk. Let's get into today's content. Hormones involved in athletic performance. So one thing about athletic performance, we need hormones, and we need a proper functioning thyroid. To get a proper functioning thyroid, which helps, I always think of the thyroid gland as our thermostat in our body. How well does our metabolism work? So and I'm oversimplifying this, but a big control of that is our thyroid gland. And to convert from inactive to active thyroid hormone, so to go from T4 to T3, so inactive to active, you need progesterone. And you need vitamin D to make that conversion. So again, you've got a woman postmenopausal, they don't produce they produce very little progesterone now, and they start gaining weight, and their thyroid starts to get sluggish because now you don't have enough progesterone in that patient. So just to say this out loud, so thyroid hormone regulates metabolism, cardiac function, protein synthesis, and calcium homeostasis. So,
did you say estrogen or progesterone?
well, this is thyroid. So thyroid controls all that, but progesterone helps go from inactive to active. Progesterone, yep. Along with vitamin D, controls that enzyme conversion too. Steroid hormones, so this is just in general. So when I talk about steroid hormones, I'm talking about all the sex hormones and cortisol. They all come from cholesterol. They maintain energy stores, build muscle, increase oxygen capacity, help decrease fatigue, optimize hand-eye coordination. Again, that right there is mainly due to testosterone, but progesterone and estradiol cortisol have a smaller benefit in that regard. But again, if a woman comes in here, and we have women premenopausal, of course. Let's just pick on a woman that's 30 years old. We have some bodybuilding women and things like that that have come in through over the years, and they love to just ramp up their testosterone and go to, and they know what they're doing, that they're testing their level, and they're just maxing that out because they like to see the benefits of their athletic performance go up, but they also have some acne and oily skin and things like that. But they're intentionally playing that game a little bit. I will say with like vitamin D, so these triathlon, these marathon runners, it takes calcium for muscle contraction, and you need more vitamin D to get more calcium into the body to get those muscles contracting and contracting and contracting and contracting and running 26 miles, all that kind of good stuff. So if you know of anyone that is in marathon running or super performance athletics, and they're hitting a wall, maybe test their vitamin D. I'm sure most super athletes know this already, and they have a trainer that's aware of what's on this slide already. I just wanted to take a moment to thank you for getting this far in the video. If you're finding value in today's content, I encourage you to subscribe to this channel. It really helps the channel grow, and it really helps to promote me and motivate me, really, I should say, to produce more videos and more content, educational content on helping you live a healthier, happier life. All right, let's get back into today's content. But just a quick point on this, there's like a lot of studies done with athletes and women in athletics and their menstrual cycle, and they're more prone to get hurt right before their period because their progesterone drops drastically. And also what happens is their body temperature goes up, and that leads to, especially if you're excessively training, you're training in a lot of heat or you're competing outdoors, you're going to kind of burn yourself up, so to speak. So, Cardiovascular health. So the risk of disease increases with menopause as estrogen levels decline. So that's another question I get all the time. I thought estrogen causes blood clots. I mean, I hear that every week. Or my doctor said, you know, I'm at risk for cardiovascular disease because of estrogen. Now that's talking about synthetic estrogen. That will increase your risk of clots and so forth, and heart attacks and so forth. But so restoring estrogen levels using bioidentical hormones, and again, to a physiological level. I can give you bioidentical estradiol at megadosing, and we can have lots of problems with your cardiovascular health. But it has to be physiological. It's got to be within that normal physiological range. If we get that, then we can improve cardiovascular health. So again, how do we know that? We've got to test. So this kind of sums this up. So actions of estradiol on the cardiovascular system: it raises your good cholesterol, your HDL. So estradiol will actually help bring up good cholesterol. It will help lower the bad cholesterol. It helps improve endothelial function, so down-regulates the master switch, TNF-alpha, of inflammation. So if we can tone down inflammation in the epithelial tissue, so that epithelial tissue is that thin lining of one cells throughout your whole entire, basically, cardiovascular system. And once that gets irritated and inflamed, that's when plaque starts to build up. And if I can stop that from even, from starting, I'm going to improve that cardiovascular system in the patient. And then Dane did a talk on nitric oxide a couple months ago. Guess what else helps improve nitric oxide? Estradiol. So if you take estradiol, it relaxes blood vessels. So, and how does it do that? It improves nitric oxide. It upregulates the enzyme to help produce nitric oxide in the body. How cool is that?
Then you're happier.
Yes, absolutely. Yep. So, and that's where you get into the hot flashes and so forth. You're getting all this flush of heat. Your blood vessels are opening and closing and so forth. It helps to regulate that dilation and contraction of those blood vessels. So, I'm going to skip over this, but this is well, I'll just read this real quick. So the Women's Health Initiative was this huge study, thousands of women, and it was looking at synthetic hormones. And they cut the study short because basically there was increasing the risk of women in a multitude of different issues and cancers and so forth like that. So, but it says, I'll just read this. So in 2000, and they keep going back and looking at the data and analyzing different parts of it. So 2002, a study found that a different outcomes based on timing of hormones and the stage of menopause. So cardioprotection, if given to premenopausal or early menopausal, you can see patients having a benefit even from the synthetic stuff from a cardiovascular perspective. Initiating estrogen replacement, again synthetic in this case, is important when the decline in estrogen begins because long-standing estrogen deficiency can alter how the body responds to estrogen supplementation. When they initiated that synthetic estrogen 5 years past menopause, they actually did not see a cardiovascular benefit. Now that's related to synthetic estrogen. So just to throw that in there. So that's where some of these doctors are referring to this women's health study and saying where after 5 years you've got to get off of estrogen. Well, what estrogen? They're not all the same. There's synthetic and there's bioidentical. So that's what they're referring to here is if you're on synthetics and you've been on them for more than 5 years, you've got to stop it, otherwise we're increasing your cardiovascular risk. Thank you for watching today's video. I hope you found some new information to even share with your physician about bioidentical hormone replacement therapy. As always, I encourage each patient watching this video to share it with their physician. And physicians, we are more than welcome to stop by the pharmacy and we can show you our lab and how we actually compound the bioidentical hormone products that patients are taking, or we can come visit you as well too. Myself or Monica are more than happy to meet with any physician out there wanting to learn more about bioidentical hormone replacement therapy for their patients. One other thing I would like to add tonight before we close is that not all compounding pharmacies are created equal. I am proud to say that MD CustomRx was the first PCAB accredited compounding pharmacy in Wisconsin, and to this day we hold that accreditation. As always, if you liked this video, please share this with a loved one, And we'll see you hopefully next week on more benefits to bioidentical hormone therapy. Thank you.